Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Dr. Michael Tanner, who is an ophthalmologist with Precision Eyes. Welcome.
Hey, thanks, Dr. Fox.
Now, I mentioned trouble seeing. It might be cataracts. Well, how do you know what are some symptoms of cataracts?
Yeah, great question. Cataracts are extremely common. The first thing that I would think would be blurry vision, obviously. Usually goes on over time. And then, halos at nighttime when you're in the cab of the car and the pupil's big and dilated. It exposes a lot of the cataract, and you might notice it more at nighttime with glare and halos around headlights.
What is a cataract?
Good question. Cataract is just the natural fogging of the lens inside of our eye. Sometimes can be just from age, and then other times can be from pathology such as diabetes or long-term steroid use.
Trauma or other diseases could cause it too?
Absolutely. Trauma can cause it as well.
Okay. So how do you know? I mean, ophthalmologist, optometrist, how do you even know what do you do?
Yeah, good question. Any eye care provider is going to work, right? You can go see your optometrist, you can go see your ophthalmologist. Ophthalmologists do surgery on it. So optometrists are very well qualified to diagnose and look at cataracts, but then they have to send you to a surgeon to have them removed.
So how do you know if you need to have it removed?
Good question. I mean, you don't really until you see an eye care provider, because the vision can just gradually get worse as you go on, and you don't really know. You almost adapt to it. So you really need to make sure you follow up with your eye care provider.
So is there a test you do to say, hey, this is bad, or if I think I'm seeing okay, why do I want to be operated on?
Exactly. We check all of that whenever you come in. We'll check your vision, we check your pressure, we dilate the eyes, and we take a good look inside of the eyeball to tell if you're a good candidate or not.
Okay, so let's say you are.
Yeah.
What do you do?
Well, cataract surgery is the most common surgery that we do in the United States. It's not the most common minor procedure. Obviously, dermatology takes the cake on that. But there's 3 million cataract surgeries that are done every year. Dr. Giltner and I do over 1,000 per year, so together. It's very easy. We make a small incision in the clear part of the front surface of the eye, and then we remove the cataract using an ultrasound machine, and then we slide a lens in that same incision, and then magically a couple days later you're seeing great.
Well, now let me back up here. You said it's a simple procedure. It might be for you, but if you're doing it on me, it's not so simple.
Exactly.
And is there just one way to do a cataract? I've heard laser, I've heard regular. You said ultrasound. How do you pick what you do?
So that's an amazing question. Everybody wonders, should I have the laser-assisted cataract surgery done or not? Back in 2020, Ophthalmology published a paper that looked at a ton of patients, and it showed that laser-assisted cataract surgery was not any better than regular cataract surgery just done manually. You're using the same ultrasound machine to take out the lens inside of the eye, and then we're using the same lenses that go back in. So really you can just have it done manually by your ophthalmologist.
Now you mentioned the lens. We've got a picture of one here. They're really tiny.
They're so tiny.
Everybody has a lens?
That's right. Everybody gets a lens inside of the eye. The one that you're showing is one piece, so all of that's plastic, acrylic actually, and it just slips into the eye and then expands out and holds it really nice and steady inside the eye and gives you great vision.
So let's say you go through the surgery, you have the surgery, do you still have to wear glasses? Do you not wear glasses? How do you know?
Some people do, some people don't. If you have astigmatism, you have to pay more for astigmatism correcting lenses in order to be able to counteract that astigmatism on the front surface of the eye if you want good distance vision. And then if you want good near vision, there are multiple options that you can choose from. A multifocal is an example where you have different focal points, and then an extended depth of field lens, which gives you good distance vision, but then also stretches a little bit for that intermediate stuff.
Okay, so it's a outpatient, quick procedure. What do you have to do afterwards?
Drops. Yeah,
Okay.
So drops, usually it takes me 6 minutes, 10 minutes to do the surgery, and then afterwards you go and have your pressure checked at the office, and then you start the drops. About 4 times a day, usually lasts for 2 to 3 weeks.
All right. Do you do both at one time, or you do one eye?
We
and the
do
other?
not. We do one eye at a time, yeah. That's just infection risk, so we want to make sure that the one eye is nice and healed before doing the other one.
Okay. Now, one quick question before we finish here. You mentioned pressure, and that made me think glaucoma. Do you deal with that also?
We do, yeah. Ophthalmologists and optometrists look at glaucoma, macular degeneration, cataracts. We look at all of that stuff whenever you come in for a dilated exam, comprehensive exam.
Well, good. We appreciate what you do. Thanks for coming in and telling us about it.
Yeah, thanks, Dr. Fox. Appreciate
All right.
it.
We'll be right back. Welcome back.